We have a powerful culture on our campus that is really multifaceted. It deals with students, it deals with adults, it deals with families, and it deals with community partners. It's a tight-knit community. It may not be a community rich in dollars, but it's certainly rich in love and support.
Chronic absenteeism has been one of our main focuses for the past 3 years. So it's something that we focus on for a lot of reasons. Number one being the kids can't learn if they're not here. And we take pride in creating an environment at Michael Anderson School where kids feel safe, where they're nurtured in every aspect of learning, not just academically, but socially, behaviorally as well. We want Michael Anderson to be a beacon of light for our kids. So we want them here every single day so that they can feel safe.
Chronic absenteeism is one of those pervasive pieces that truly can limit someone's ability to be successful in the future. When a child is out, even if it's just for one day a month, that adds up.
We're like almost 99% free and reduced lunch school. Grandparents are raising the kids. Single mothers or single dad are raising the kids. Parent has 2 jobs, they're up late at night, kids are at home by themselves.
If you're not feeling well, something's happening at home, that's just taking over your ability to be able to concentrate. What's happening in that classroom, whether you're there or not, you're missing it because your attention is elsewhere. It was an opportunity to take away the obstacles to our children being able to have additional resources right here in our community.
At the first meeting with Dr. Hargrove, I quickly realized that she was a unique superintendent that really was exceptional in her thought about what her students and families really needed. That, for us, was a real selling point that we were going to have an educator who really understood that the system is not just about the curriculum, but also all the other support systems around that community.
We're going to mitigate as many obstacles as we possibly can to learning. We're going to use resources and relationships and partners who have opportunities and focus that are different from ours to augment the work that we do.
Their ability to cater to the whole child. Our families have trouble getting to the doctor, getting to a place where they can receive services, and having them right on campus within walking distance of our school has been incredibly valuable because they're just viewed as part of the school. And our families have really taken advantage of that.
What we have is a partnership that's built around wellness coaches. So a wellness coach is really a licensed mental health therapist that is embedded and becomes part of that school's culture.
I'm integrated inside the school, so I have a classroom there, and it allows me to build a relationship with family and students and teachers, all the administration, because I'm actually there.
The first time that we met Carissa, she walked in and I immediately felt, oh, I could relax. I felt, that this lady loved my son and genuinely cared about him and wanted to help him.
Nobody's asking what's going on at home. Nobody's asking, did this kid eat? Nobody's asking those questions. So instead, we have the wellness coach come in, observe, and our wellness coach meets with the parents, gets their approval, and now can work with that family within the context of the safe school. It's now part of their education. That's how we're destigmatizing mental health and also trying to give teachers different context. A lot of times teachers just see this child as someone who's disrupting everyone else, not really understanding that this kid may have trauma. We now can provide that context and train the teachers on how to respond.
Julian was very impulsive. He felt the need to get up, run around, and do it in the middle of class. He was very chatty and would get bored and do his own thing. He would yell in class and had issues with other kids.
I think it's important to be embedded in the school, and it's great that things are being reported to me through sessions, but to go into a classroom and actually see what's happening is an entirely different story. To be on the playground and see the kids playing, how they interact with each other, to get to know teachers and their classroom management styles.
A lot of the times our wellness coaches go to schools and spend the first 3 to 6 months just building relationship, going to community events, really being seen as a resource and as someone that can be trusted and not just being thrown into that process.
We bring the parents in face to face. We're not forcing something on them. We talk to them about what has done for some of our families. We have the forms already on hand. There's no waiting period. Everything's right here on our campus. We also bring Carissa Vela right up to the office. And once they meet her, then you start building that relationship. And that's part of our culture. We build relationships with our families.
The key is making sure that everybody involved and all of our stakeholders, whether it's parents, teachers, students, see as a natural part of the school. Chronic absenteeism rate has definitely dropped since I've become a community partner. That's been wonderful. You know, more kids here every day.
When a kid comes to the office, the first thing that's on our mind is how can we best support this student?
The biggest change I see in students since I've started is positive interactions. Once they do have that interaction, it's a completely different experience. Students being able to kind of build empathy, learning what it means to feel for their teachers or peers if they don't get along with them too.
Julian is now more confident. He's a lot happier, and he doesn't have behavior issues now. He smiles more. He looks forward to school. He tries his best and is one of the top kids in his class.
I've seen a change in the families, students wanting to be at school more, less behavioral issues, less students in the office because they're having issues at home, because the health initiative is working both with the families and with the student.
Since working with Carissa, my relationship with Julian has grown stronger. She's given me skills in how to deal with him and how to help him and just how to be there for him. And because of those things that she's taught me, I've become a better mom too.
We're going to have difficult times, but since we're doing all the right things and we have the kids' best interest in mind, we're going to keep doing that, trusting the process, and we will be successful.
I think it takes a long time for you to see the value manifest in what you do for children, right? But if this is done correctly, you can change intergenerational trauma. You can change the socioeconomic outlook for families. It's much easier to build stronger children than it is to fix broken adults.